Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. So, as we know, we are discussing about Graha Rogas. Now, today we will see some of the mythological explanations given in the Graha Rogas. Now, if you look into the Graha Roga chapter, many things are mythologically explained. Okay, it's actually very difficult to understand this mythological explanation, and it is very difficult to convert it into scientific understanding. Now, it's very difficult to decoding it, but if you try to decode it, most of the time we come to a clear-cut conclusion that this is nothing but microorganisms. Now, if you look into the story of the Revati, a big story has been explained for the Revati, that how she is attacking the pregnant lady, purpurar lady, or the adolescent girl or pregnant lady, etc. There is also a big story. In the Putana, origin of the Putana Graha, in the Putana Graha also there is a big story. In the Krauncha Parvata, there was a big demon, and how Skanda went there and finished him, killed him. And later onwards, there is production of the dirt which was there after fighting. So that get into the form of a graha, and that graha is called as Putana graha. Similarly, for the Naigamesha, for the Mukhamandika, for each and every graha, so there is explanation of a story which is mythological, but it has got a hidden scientific understanding. The idea is very clear. Most of the time, the new infections will arise after a big drastic war. Okay, that we can take from the history also, recent history also. Whenever there is a great wars, okay, terrible war, most of the time most people die, and the debris and all those things, that itself leads to the formation of one particular new infection, okay, like anthrax or maybe like influenza, etc. Now, therefore, in the grahas also we have got such stories. So probably each graha is produced after such a drastic wars. Okay, so indicates that the struggle or war, which may indicate the same struggle between the body immune system and pathogen. That is one thing. That is, this mythological stories are explaining that there is a creation of a new potent virulent infection after each and every war. That's the one thing. Or the war which is explained here may be symbolic, and that may be indicating the struggle which is taking between the body immune system and as well as the pathogen. Okay, so when a pathogen enter inside the body, how the body reacts, the war takes place, and then what is the after effect. Okay, so this may be compared to a fight between the body immune system and a bacteria or pathogen. So people of those days believe in religious things more rather than the scientific things. So although nowadays it is vice versa. So to make the people understand, the requirement in those days is everything has to be explained in the religious bottle. Now exactly vice versa. So we cannot believe the religious things now. We always want the scientific proof. But about 100 years or 200 years back, situation is that if you say anything scientific, people are not ready to agree you, and even the king is also not ready to agree you. This is what happened to Galileo. You know that. So when Galileo told the truth, so people throw the stone to him, stone pelted against him. So it's very difficult to tell the medical truth or actual truth in those days. So they have used the religious bottle to present that particular truth. So therefore, most of the factors of Graha Roga is explained mythologically. Ayurveda cleverly introduced the health principles in lifestyle. Not only in Graha Roga, if you look into Ayurveda, many principles are explained under the religious bottle. So idea is, whatever may be the case, let the people follow it, maybe religiously or scientifically. If they are not agreeing scientifically, religiously let them follow. The only motto is they should be healthy, and they should live a long life. That was the motto. Okay, so therefore we find many religious matter and mythological explanation in Ayurveda, and Graha Roga is one of the same thing. Now, if you look into the symptoms of different Graha Rogas, so symptoms related to the central nervous system is also there, especially in Skanda Graha and Skanda Pasmara. Respiratory system will be there. Then symptoms related to the dermatological system is there. Gastrointestinal system is there. Urinary system is there. Genital system is there. Psychological system is there. So it implies that the Grahas causes the multi-system disorders which commonly seen in infectious disorders. Okay. Symptoms related to one system is more, but along with that, other symptoms are also there. That is, multi-system involvement has been very clearly mentioned. There are different spells in Graha Rogas. Now, this is a very interesting topic. If you look into Graha Rogas, for each Graha, they say that suppose it emits a different smell. Suppose Skanda Graha I am telling, then the patient will outburst a smell of the blood, or sometimes Kakaganda, Ajaganda, Goganda, Gomutra Ganda. So like the different smell has been get emitted from the body in a particular affliction of the Grahas. Now, outbursting of the different smell in the graha is a very interesting topic. Okay, from the smell may come out from the body surface, urine or fecal materials. Now, usually, if the person is not hygienic, not taking the bath properly, so there may be smell. Otherwise, the smell may be there in obesity. Okay, staulia person, we know that because there is excess production of the sweda is there. Because of sweda, there may be daurgandhya may be there. Apart from that, apart from these two conditions, if a person is clean, in spite of that he is smelling badly, so mostly always it indicates a metabolic disorder. That metabolic disorders may be inborn disorders or acquired disorders. For example, diabetes too will have a ketone smell, acetone smell will be there. It's a metabolic problem. Diabetes is basically metabolic problem. Acetone smell will be there. Maple syrup syndrome, you will have another smell. Phenylketonuria, that's a change in the color of the urine, and smelling is also there. Okay, alkaptonuria, there is, so like that different metabolic problems, usually we will have different types of smells coming out from the body. Okay, so collection of apocrine secretions also give the bad smell and also gives a shelter to the infection. So this may be one consideration. Now even in the fever, suppose, yes, even in the fever also we experience a typical subjective smell, which cannot be identified, isn't it? Suppose your kid is suffering from the fever, immediately you will feel a typical type of smell. You cannot explain that smell, but that smell will be there. Okay, even in the fever also there is metabolic disturbance, isn't it? The respiratory rate increases, so the body heat increases. They are all the metabolic changes. So probably in case of grahas also, the different metabolic changes are taking place in the body when they cause the disease, and that leads to presentation of different smells. This is quite interesting topic. Now, coming to the Jataharani. What is Jataharani? The Jataharani is a word which is only mentioned in Kashyap Samhita. The Revati Jataharani is mentioned. Jataharani is nothing but the transformation of the Revati. Revati is a Graha, and transformation of that Revati itself is a Jataharani. All the others mentioned Revati as a Graha, while Kashyapa explained Revati under Graha and as well as Jataharani. So Revati is considered as Sarvaloka Bhayankari. Okay, now actually this is a code of conduct that has to be followed for the adolescent girl. Now Jataharani is not especially mentioned for the males. It is for the girls, adolescent girl, pregnant lady, purpurar lady, and the newborn baby. Okay, so they are the one who are get affected by the Jataharani. The Revati Kalpa Adhyaya explained by Kashyapa gives a code of conduct to be followed by adolescent, pregnant or a purpurar lady. Causes which makes the female more prone to Jataharani. So if you look into Revati Kalpa Adhyaya, beautifully detailed explanation has been given. But still, what causes Jataharani? That means intrauterine infections, perinatal infections, postnatal infections, purpural infections. Okay, so how it can be possible? Abnormal, illegal sexual relationship of female with the husband and also other than multiple partners. That is one of the major cause. Then sexual hygiene between husband and wife. It give more stress for this. Contact with the husband who has illegal sexual relationship like HIV-like conditions. Not following the rules of Naishtika and Vaivahika Brahmacharya. Not following the Rajaswala, Rutumati, Paricharya, etc. Now I am giving the gist of Revati Kalpadhyaya. Okay, the Revati Kalpadhyaya, these points have been highlighted to higher extent. Now, symptoms of a lady who is seized with the Revati, okay, loss of mental stability, improper nourishment, loss of interest, looks very ugly, development of many disorders, then do every work in opposite way, consume opposite and non-congenial food, do every work in abnormal and improper way, do not get success in money and prosperity, then again attain the widowhoodness early, then kulakshaya. So these are some of the symptoms which are lady seized with the Revati. Now, coming to the prognosis of Graha Rogas. All the Graha Rogas are fastly progressive and difficult for the diagnosis and treatment. In Skanda Pasmara, it is told that the residual physical disability or death is certain. A person who is suffering from Skanda Pasmara, it is told, Skanda Graha, it is told that some of the disabilities are certain. But definitely leave back some of the residual symptoms, maybe loss of strength in one part of the body or one limb, etc. And those grahas which are coming with the himsa are considered as incurable, and those which are coming with the intention of rati, completion of the life cycle, they are curable. With the intention of getting archana, they are considered as easily curable. With the rati, they are curable with the difficulty. Following are the symptoms of incurability, and such patient should be rejected. Okay, you should not touch Graha Roga patient if these symptoms are there. For example, Udare Granthi, Vriddha, etc. So, a list of symptoms has been given. So, these are the patient that you have to reject. Agnidanda Homa and assessment of the prognosis. So, Vagbata explains a very typical method of diagnosis and prognosis also. What Vagbata says is, Graha Rogi will be made to sit in front of the Homa Kunda. One Homa should be performed. By observing the color of the flame, the prognosis will be decided. Probably the chemicals which are released from the body through the respiration, maybe, so respiration, etc., they comes in contact with the flame of the Agni and gives an abnormal color, probably. And by looking at that abnormal colors, so physician used to identify the prognosis, decide the prognosis of the Graha Rogi. Okay, so these are some of the basic points which are explained for the Graha Rogas. So with this, the general introduction of the Graha Roga is over. Now in the next class onwards, we will look into the treatment of Graha Rogas. Thank you very much.